The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our socially distant technical producer, J.D. DeAngelis. Brad and I welcome our guest from Mercy Medical Center, Dr. Maurice Chung, Director of Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology.
Everyone uses their bladder many times a day, but they may not know what to do to keep their bladder healthy. Urinary tract infections, or UTIs, are the second most common type of infection in the body and can happen anywhere in the urinary system. More than half of women will have at least one UTI in their lifetime. Older women are more likely to get UTIs because bladder muscles weaken and make it difficult for full bladder to be emptied. This morning we're going to talk with Dr. Chung about bladder and bladder health and bladder concerns. We'd like to remind our listeners that our program is available on our podcast. Look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and you can listen to any of our programs anytime.
So, Dr. Chung, welcome back to the show, and tell our listeners a little bit about yourself.
I moved to Canton for 2 years, and I've been in practice in Ohio for the last 30 years. And I am a urogynecologist, and my focus in the last 30 years have always been in pelvic pain, endometriosis, and painful bladder syndrome, which is the interstitial cystitis. And I finished my training in Boston and New York, and I'm board certified in general obstetric gynecology as well as in urogynecology and female pelvic medicine and reconstructive surgery.
Okay. That's very good, Brad. Maybe you better move on with the questions.
Okay. All right, doctor. What conditions do you specialize in at Mercy Center for Endometriosis, Pelvic Pain, and Urogynecology? And what are some of the common things that you see every day?
Well, first of all, at OBGYN, and we take care of women for all ages. But as a urogynecologist, the focus changed. So I usually see women or younger adults for the menstrual cramps and pain, sometimes with painful sex. And as they are getting older, as they age, then the problem of the urinary system, such as urinary incontinence, which means that they leak urine, with coughing or sneezing, they may develop some symptoms such as have to go to the bathroom a lot, or they urinate a lot in a day. And then sometimes they have pain on urination, as well as they age, some patient would have the pelvic organ falling out of the inside of the body. And so these are some of the disease that I've seen. And so it's all spectrum, and all these could appear and happen in many age groups.
I'm guessing this isn't something that a lot of people like to admit or talk about. So I'm guessing sometimes by the time they get to you, the provider, they probably have been dealing with this problem for a while. You mentioned some changes to the bladder as people age. What exactly happens?
Well, first of all, the bladder, I call that the second brain, because when they're good, they listen to what you have to say. As women age and getting older, and then the bladder tend to behave the way that it likes, and it just don't want to listen. So the bladder wall, within the bladder, they become leaky. When I meant leaky means whatever bladder is like a bag. So whatever the waste from the body goes into the bladder seal it off and keep it until the time that you want to go to urinate, then you urinate all out. The chemical inside the bladder in the urine not supposed to be going back through the bladder back into your body, but they do. a small amount of those could leak back into the system and create problem. Just like our brain, we have a barrier, and normally a lot of stuff that just could not get through. But in the bladder, the same thing. There was a barrier there, and the urine chemical were not supposed to get through. But somehow, as we age, they would start to bother you because a little leaking in there, and the chemical could go through.
Okay. So let's look at several common bladder problems. So let's begin with a urinary tract infection, or what we often term as a UTI. What are UTIs, and how common are they? And is any one type of patient more likely to get them than another?
That's a very good question. As you first pointed out, half of the women in the lifetime would have at least one UTI. And the younger patient, that they may have urinary symptoms, such as urinary urgency, which means that you have to go to bathroom a lot, and sometimes if you don't go, you have pain. And some would have burning in urination, and the older patient that the UTI may just present it as the leaky bladder or lower back pain and don't have symptom on urgency or frequency or burning. So these are all the different variety of symptoms that you can see. Some of those would have blood in the urine. And it's a symptom that brought the patient to see the primary care doctors more. And they usually will get a clean catch urine, such as like you have to pee in a cup. You know what I mean? The first 10 seconds, you're not supposed to collect it. You really have to clean your genital area very well. And then once you start urinate, you have to stop up to 10 seconds. Then you collect the 10-second urine and try to pee in a cup. Now, that is a very, very difficult to do. And so then when there's any contamination, okay, you get contamination, you get some bacteria actually come from the genital area, and then you have the symptom. Automatically, that's like a UTI just because of the symptom, and there may not be any culture grow out. So that brought out some of those not true urinary tract infection, but the symptom dictates it. So they get antibiotic, and they're told they have a bladder infection.
Okay. As the body ages, okay, and I know you kicked this around a little bit, but as the body ages, how about the symptoms? I mean, does the individual 70, 80, whatever, not feel any symptoms of a urinary tract infection? Or?
Well, some do and some don't. And some would just come in and say that they have to urinate a lot, they have urgency and frequency. And some patients actually have no symptom, but then when you did a culture for them and they show bacteria. And more common symptom would be incontinence, like leaky bladder. And the urinary leaking for elderly, you got to make sure they don't have an infection, because that's one of the reasons why they turn out to have a leaky bladder was infection. Lower back pain is one of those. Some patient would come in just because of the lower back hurt near the sacrum. So these are some of the symptoms for the elderly. And for the younger one is urinary urgency and frequency. They can tell you. They usually could tell you they have a bladder infection. It's in the younger population.
Because their sensory is 100% or is better than an older person?
That's right.
Okay. So one type of UTI is a bladder infection. What is a bladder infection? How common are they? And are there any precautions our listeners can take to reduce their chance of getting a bladder infection?
Bladder infection is a bladder infection. And it's an infection. You get bacteria in the bladder and create inflammation. And sometimes you have pain near the lower pelvis area, and with burning on urination, and if you don't take care of it, some of these can turn into bigger infection, because the urine, when it's infected, and started to migrate up into the kidney, so that could be serious. So they are common, as we talk about women. 1 in 50% of those in their lifetime would have at least one. And the older the patient gets, the higher chances the patient could get a bladder infection. So how to reduce the chance of getting a bladder infection. That usually is the personal hygiene. And when women use the bathroom, they are not like men standing up there, and because of the anatomy. So when after they urinate, they need to clean, then make sure that, I think this is well taught now, every girls know that they don't wipe from the back to the front, they wipe from the front to the back. And many of these patients, when they have the infection, and some of them don't drink enough fluid, and that's another reason why they can get urinary urgency frequency and then have a concentrated urine in the bladder that could irritate the bladder a lot more.
Over the years, there's been some conversation about keeping the bladder acidity basic, okay? And not to consume acidic products like vitamin C during the time when you have a bladder infection. Where are we on that?
Yes. The bladder is the biggest organ of the pelvis, so you know, okay? And a general bladder, when to the full capacity, when a person is under anesthesia, the bladder can stretch all the way up to 1,000 cc's. So that's huge. You put 1,000 cc's, right?
It is.
And the bladder has a lot of muscles. They call it detrusor muscles. And within the urothelium, the lining of the bladder, there are so many sensory fibers, nerve. So as I said, there is a genetic variation of patients that they're prone to get symptom of urinary urgency frequencies, and it's just a genetic, they're lacking certain type of protein, and I want to label that group as patient with painful bladder syndrome or interstitial cystitis. The bladder urothelium is supposed to be like our brain, is very tight. You're not supposed to have crack in it. Or the nerves are supposed to be normal, not the type that can send pain signals so fast. So when the bladder lining is leaky, the chemical in the urine could leak into the lining of the bladder, and so can irritate the nerve and causing the inflammations. So acid, anything that is acid, cation, like positive charge, like potassium, acid, spice, they can go right through this layer and irritate the bottom nerve. And that's why what the questions you have with the acid can cause the symptom.
Hey, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing bladder health with Dr. Maurice Chung from Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology.
Okay, Dr. Chung, we know that bladder infections, if left untreated, can turn into kidney infections. What signs and symptoms of kidney infections, and why are kidney infections such a problem?
Well, we talk about bladder infection, which is very common. And the bladder is the collection, the reservoir of all the waste product coming out from the kidney. Kidney is the filter system, and with two pipes coming down to the bladder, those are the ureters. So when the bladder have an infection, a true infection, and when it's not treated, the infection would follow the urine flow and would go up to the kidney, and then they have the kidney infection. Once you get the kidney infection, sometimes it gets so bad it could turn into urosepsis, means that they will pass through the kidney, go into the bloodstream, and cause the infection of the whole body. And so therefore, the bladder infection needs to be treated, especially the elderly, that this is more common. If you get a urinary tract infection, if it wasn't treated, they can turn into urosepsis, which is the infection of the whole body from the bacteria in the urine, and it's serious. They can lead to multi-organ failure if there is any bacteria that was resistant to the antibiotics.
We haven't talked about risk factors yet. Is there anything in a person's lifestyle that, or even genetics, that might affect their disposition to their bladder health?
Yes, and I have seen so many patients, they start to have trouble when they were when they're 10 years old, 8 years old, 9-year-old, starting at that age. And the symptom is just that urinary urgency and frequency. They need to pee a lot, and some of those that treated by the family doctor thought that they have a bladder infection, and they took antibiotic, and the symptoms didn't go away. That could be a group of patients with lower urinary tract symptoms that started out at that age is the nervous system. And the other things that can affect the bladder health, those are the ones that we talk about: acid, spice, pepper, cigarette smoking, alcohol, and chocolate, and many of those things that we daily consume, such as the pizza. The pizza is not the pizza itself, it's the red sauce on the top, which is tomato paste that turn into very acid. So these are some of the problems that can irritate the bladder if a patient's bladder is already susceptible to it,
Very interesting. I never thought about pizza, and I know tomatoes are acid, but I never thought about that. So, and I don't think I've ever heard that before either. So that's very interesting. So I don't know what to say. No pizza tonight?
Oh, you can have the pizza, but don't put the red sauce on it.
Wait a minute. Pizza's not pizza without the red sauce, is it?
Right. Yeah, and you talk to the patient with painful bladder syndrome, and those have urgency frequency, then they'll tell you any marinara sauce and those chili pepper, chili beans, so then they really upset the stomach.
All right. Okay, we better take the news at the bottom of the hour. News is up. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
It's a winter wonderland at Studio Arts and Glass. Our annual holiday open house now through Thanksgiving. Take 20% off your entire order. Hand-blown glass ornaments, your Santas, jewelry, come make a wreath or a glass snowflake. 20% off your entire order. See our extended holiday hours at studioartsandglass.com. Shop local this holiday season.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, gang, you're listening to Health Matters, as the announcer said. And today, Brad and I are discussing bladder health with Dr. Maurice Chung. We've got a lot more to cover this morning, so let's get back to the show. And how about the patient's weight, doctor? The amount of physical activity also, does that impact bladder health?
Oh, yeah. So, for example, if a patient have leaky bladder, like when they cough and sneeze, they leak urine, the weight has a big part of it. So when patient with urinary incontinence and the bladder is weak, the body's weight can impact with worsen of the symptom. So weight loss of about 8% of the body will automatically decrease the stress urinary incontinence by probably go to a half if the type of leaking is from coughing and sneezing. And another thing that may impact patient's bladder is the high-impact exercise. Even a younger patient, if they do a lot of jogging, hopping, and that would put the weight of the exercise onto the bladder, and then they can end up with urinary incontinence. So with incontinence, actually they soil the genital area, and that increases the chances of bacterial overgrowth. So it does cause some of the problem.
What about long-distance runners? I mean, these marathon people, all that sort of thing. Okay, they're going to run 26 miles. What's it going to do to their bladder?
Well, not for the men. I think we are lucky. And then for women, some of those do have that exercise-induced incontinence. And what do? Well, there's got to be a way to fix it. And that will go into all the treatment of stress incontinence, water consumption, and it's all individualized. Because, if they run and jog, then they start to leak urine. And some patient will end up using some obstructive method to block the leak. And sometimes they put a pessary in there during those situations. And it happened more for runner, jogger after childbirth. So that happened, and that is the individual treatment with that type of populations.
So we can't fix it, right? Okay, we jogged all our life, we ran all our life, our bladder's messed up. What's the next one? You can fix it?
You can fix it surgical.
Right, great.
You can fix it, but then again, you got to go to, are they done with childbearing? Would another child just change the surgery? I mean, to a certain extent it would. So it's individual discussion of what they want to do. So that, your question was right. The weight and exercise, physical activity, and causing stress urinary incontinence.
So, doctor, there's a fair amount of medications out there for bladder health. What are some of them, and what do they do?
Well, I think Brad asked me about the lower urinary tract symptom before. And then many of these medications treat urinary urgency, frequency, and incontinence. You have the Vasicare, you have oxybutylene, which is on the face of the earth for so many years. You have Centura, you have Enablax, you have Detrol, and then the so many others. And the one newer one is called Myrbetriq. These medicines work on relaxing the bladder. So it is not really for the treatment of stress urinary incontinence. It actually slows the bladder nerve from firing, and so that you don't have the type of leaking, such as you gotta go, you cannot make it to the bathroom. As soon as you feel the urgency, you leak. So these are the different type of urinary incontinence which these medications treat. And so the lower urinary tract symptom, which is urinary urgency, frequency, sometimes they get up so many times at night, and or when they urinate, they have burning. So these are the type of medication that may help. But traditionally, this medicine does not help the urinary urgency frequency. It may reduce 25%. So if a woman have to go to urinate 20 times a day, 25% is only cut down 5 times. So that's why many of these medicines, that population did not seem to help. However, for the leaky problem, this medication helped to about 60% to a certain extent. So it works on certain patients. Okay,
we've got these products out there with caffeine in them, like coffee, okay? Mm-hmm. And as much as I love coffee, it doesn't really love me, the caffeinated brand, that much, these days anymore. So what's a suitable morning drink that isn't loaded with caffeine or whatever, And of course, There's other issues here too, like smoking and alcohol. So
you see, that's a very interesting thing. Caffeine is a phosphodiesterase inhibitor. It's supposed to go to the brain. It relaxes some of the smooth muscle. So sometime, and that stimulate the urothelium and make the patient feel that they have to go. So leaking could occur. Whether you take the pill, it's still the active ingredient in it, but the caffeine itself has the tannic acids in it and the caffeine alkaloid, and those are the irritant for the urothelium. So I don't think there's any white caffeine, which is other than you dissolve the pill in the water, but you're still going to get the same effects. And for patients that have incontinence, that will make them worse.
Okay.
One cup is not too bad, I guess. Everybody can handle just 1 cup or two.
What about tea? I mean, is it more heavily caffeinated, or are there?
Well, tea actually is worse than caffeine. Depends on the type of tea. There's certain tea that has a lot more caffeine than the coffee itself. So okay. Why is it chocolate is another issue? Chocolate is theobromine, theophylline, theobromine, xanthine. So these are all the same family, and that's why they can cause the same issues.
So a person drinking coffee, and I can't remember the drug that has loaded with theobromine, and a couple of, I mean, that could really mess up your day, right?
I know. And so on the lower urinary tract symptom, the type of patient have urinary urgency frequency, they go a lot. They feel that they have a bladder infection, but they don't. And basically, the bladder nerve was on fire all the time. And so if you have chocolate, they like chocolate. Ladies love chocolate. And when they have chocolate,
they're happy.
The bladder, yeah. Know that. Now, if you have white chocolate, and I don't quite understand the difference. Maybe the color has a lot more chemical in it.
But I don't think there's any chocolate in white chocolate. Is that?
Oh, yeah, there's white chocolate, and there's some, not common, but it doesn't taste like chocolate to me.
No, for sure. I always heard it didn't have any chocolate. It was kind of synthetic or something like that what was in it. But
well, in Mexico and some other places, if you pay a visit, there's this chocolate in it. It doesn't taste sweet. And you take a bite, it tastes so bitter.
Yeah.
And it messes up your nerve on the day because they really stimulate your mind because that is so much of the theobromine and caffeine in it.
Wow.
Does smoking or alcohol consumption predispose you to any additional bladder problems, or does it affect you kind of like caffeine did?
Yeah, cigarette smoking causes bladder cancer, and that is one of those risk factors. Alcohol consumption, alcohol is a diuretic itself, and it's muscle relaxant. So when you drink alcohol, it makes you pee because it suppresses your brain center, and for the anti-diuretic hormone, and it suppresses that, so you pee a lot more. And then when you have the smooth muscle relax, then when you have to go, your bladder doesn't have the control, and just you get more urinary leaking problem, and makes you have more urgency and frequency. That's how that's affected too. Yeah.
So we talked about jogging and running. Are there any other physical activities that could impact your bladder health?
Mostly these are the type. Jogging, running, high impact, that's causing leaking. There is another issue with that. If the bladder nerve is tied to your lower back, it's connected by nerve, and any exercise that can stimulate those muscles, okay? Now, pelvis have pudendal nerve, which control all the muscles in the pelvis. And pudendal nerve usually can give you some of the symptoms of urinary urgency, frequency, and sometimes spasm on urination. So like belay and gymnastics, that do a lot of split, that really stretches the pudendal nerve. Bicycle riding, horseback riding, motorcycle, that can stimulate your pudendal nerve, causing the bladder to feel worse, like urgency or frequency. Sometimes they have pain. So that's going to a different category of the bladder issue. It's a neuromuscular issue that's causing the problem for the bladder.
Okay. All right, that's pretty interesting. We've talked a lot about signs and symptoms of UTIs. Are there different signs and symptoms for a bladder problem in general?
Well, let's say the most common is they have dysuria, burning on urination. They have urinary urgency, frequency. They wake up in the middle of the night. They would go 3 or 4 times. Some patients could see blood coming out of the bladder, and their fever, their lower backache. These are the general symptoms. And for the senior population, this may not be. And the symptom could be so subtle, but incontinence become a bigger issue on those. So incontinence happen to be more common in the senior population when they have a bladder infection.
Amazing. I suppose we'll take a break now, okay? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters. This morning we're talking with Dr. Maurice Chung. So let's get back to the last segment of the show.
All right, doctor, we talked about a lot of signs and symptoms and lifestyle effects on your bladder and bladder health and maybe some disease conditions you might have. How about we talk about some treatments? So how do you treat a UTI, and how do you manage a recurring UTI in a patient versus maybe one that's just one and done?
Well, blood infection, that the patient that was having symptom of blood infection, we talk about those symptoms. Those are the ones that would go to see a family doctor, and they would, let's say, for example, a UTI. And many of those, they do not run the culture. And so, as I said, when you're trying to get a clean catch urine and then you have the symptom, and you may have a little bit of bacteria in there, and then you take the antibiotics, and then you're better. Okay? Now, let's say it's the most common type of infection. You have it once, you take a little bit of antibiotics, you're better. But then, after you take the antibiotic, and if you're not better, then a culture should be done just to identify is there a true infection or not. Many times it's just because of, the second time, okay, you go and have a midstream clean catch and say, you have the symptom, you take the antibiotic again. So it's like repeating itself, the whole treatment, but then maybe there wasn't a bacteria there. Maybe this is the lower urinary tract symptom. So that the infection first time flare up the nerve in the bladder and make the patient feel the same way, but so the antibiotic doesn't work. So these are the group that can set up the stage called an interstitial cystitis. Now, for patients who have recurrent urinary tract infection, that seems to be go back to the senior. Then when you take the antibiotic, you have a culture, you treat the patient with the symptom, and the symptom goes away, and then you repeat a culture, then she's clear. So many times we don't repeat the culture, but it's important for this group of patients, we got to make sure that they don't have infection. So you have to really treat those patients very carefully. You treat them, check the culture. If they are clear, you make sure they don't have it anymore. And if they come back, you got to have a culture. And for elderly, you can't just say, okay, you feel that you have a little bit low abdominal pain and a little back pain, and, there's some bacteria there. And usually that's useless. And they get over and over and over again because the urothelium is not intact as like we do. And they are menopause. They are lacking estrogen. So the urethral opening is already a problem. So we have to do the culture, wait for the results, make sure that it's sensitive, and then if the elderly, make sure they use a little bit estrogen, external estrogen, to kind of helping the urethra to be a little bit stronger, instead of the bacteria from the genital, external genital can go through the urethra and causing some blood infection. Drink a lot of water, empty your bladder that way, because reflux of the urine sometimes happens. And that is one of the things that cause the upper urinary tract infection, because as the ureter move, and when we suck the urine from the bladder back up into the kidney. So that is a serious condition on elderly. We cannot depend on just the symptom. We have to make sure whether they have the bacteria growth and sensitive to the antibiotics.
So what about over-the-counter products that we're hearing all this hubbub about, the azo products, things like that?
The over-the-counter product, and again, is the urinary alkalinizers. So, for example, the pre-leaf and acid neutralizer, there are so many over-the-counter products that neutralize the urine because the patient have the urinary symptom, but not necessarily an infection. It's the acid in the urine that irritate the urothelium and causing the symptom. And for example, another group of medication called azo, which is basically pyridium, phenazopyridine, that change your urine orange. That is not really treating the infection. That's actually numb up the bladder urothelium. So it's to help with the symptom. And so for infection is one thing. For the lower urinary tract symptoms such as urgency, frequency, and if you don't go and then you feel the pain, and if that becomes a lot, And many of those are, you don't have a urinary tract infection, but those are the ones that are going to get interstitial cystitis or painful bladder syndrome. The lower urinary tract symptom has nothing to do with UTI, a bladder infection. The bladder infection may start off first, and these patients' symptoms continue to go on.
So, doctor, how can a patient get in touch with you?
I'm in Mercy. My cell phone is 330-489-1379. They can always call Mercy to get an appointment, and I'm open to all type of problem for patients that need help. And I'm very much want to start a center in Canton is to try to help out all these patients with all these pain and menstrual pain, bladder pain, or incontinence and prolapse. They can call the number, or on Facebook, there's always a way to find me.
Any other tips you'd like to leave our listeners?
Very much. There's one thing that is very true. The lower urinary tract symptom, the urinary urgency, frequency, you got to get up at night more than twice, and after you empty your bladder, and then you don't feel empty, you want to go back there again, that's not necessarily a bladder infection. That is a painful bladder syndrome or interstitial cystitis. So that will give you some chance to think about what exactly you have, because bladder infection, you take the antibiotic, it goes away. These are the ones that you take antibiotic, maybe it helps, and then it comes right back. So that's one of those things I want the listener to know. And don't eat too much spicy food, acid. Some patients drink vinegar, and that can cause problems. So,
okay. All right, doctor, we're out of time. Drink vinegar. Okay. Thank you very much, Dr. Maurice Chung, director of Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology at Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your health care provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
What's next? Keep listening to find out.
All of us have to come together to fight this enemy.
Because the news never stops, and neither do we.
At least 47 states experiencing a resurgence of the virus.
The virus is raging throughout the state of Ohio.
We're here to help.
You really need to do whatever you can to try to maintain social distancing. Make sure that you wear a mask whenever you're out in public.
At the local level, listen.
1480 WHBC and WHBC.com.